Hey guys, Dr. J here. We're going to talk again about blood pressure today. Last time we talked a little bit about what is high, what is high blood pressure, how to diagnose it, and the effects it might have on your body if we don't prevent it and don't treat it. So today we're going to learn a little bit more about that prevention and what are our options for lifestyle treatments as well as medical treatments. So first, we're going to talk a little bit about lifestyle. As you kind of guys all know, lifestyle is my primary focus and trying to keep everybody off of medications as much as possible. And prevention is the best choice for that. So pretty much everything I'm saying could be things that you could implement now to reduce your risk of developing blood pressure, or if you're in that early phase of high blood pressure or only mild high blood pressure, you might be able to reduce your numbers to prevent the need for any medications. So these are Dr. J's top life changes to preventing or treating high blood pressure. Number one, we can't start anything without talking about exercise, right? So we talked a little bit about last time how exercise increases your blood pressure while doing it. Remember, we're going to raise your blood pressure to get blood flow to the extremities and give our body the blood flow, oxygen, and nutrients it needs while exerting itself. But what's great is after we exercise, we have a prolonged decrease in our blood pressure. You could lower your blood pressure roughly 5 to 8 millimeters of mercury. So once again, we talked about numbers last time, 140 over 90. You might be able to bring that number down to 132 to 135, which is a nice delta there, a real nice difference, and possibly could get you out of the medication zone. When we're exercising, we're going to dilate out those vessels. It's going to put less work on our heart. We have talked in the past about exercise. We want to do roughly 150 minutes a week of various forms of exercise, from cardio to resistance training. If we go a little more intense, we might be able to do 75 minutes a week of higher intensity exercise. As well, we want to make sure we get our steps in during the day, at the very least, getting those 10,000 steps in. And as well, in the past, we have talked about sitting disease and how we want to kind of reduce sitting disease and keep our body moving, because being in a sedentary position for an excess period of time definitely puts us at risk for heart disease, such as high blood pressure. If anybody needs a refresher on this, we did go into this in a lot more detail in episodes 5 and episode 6. Feel free to review them and check them out. Number 2, what goes hand in hand with exercise, of course, is diet. This is even more potent than exercise. We are able to lose up to 10 millimeters of mercury by eating healthier. So pretty nice numbers right there. You can now bring your number from 140 down to roughly 130 potentially by being healthier. We could talk all night and all day about diet, but we're just going to talk a little bit about highlights on where I think we could put our focus and energy. We once again have talked about this in the past. We want to avoid processed food and sugars, really eat natural whole foods, avoid things that are packaged, made in a plant, and aren't natural. You hear a lot on TV about sodium. We want to decrease the sodium in our diet and increase our potassium in our diet. So sodium is probably not quite as bad as the media portrays it to be. In my humble opinion, I think that there is a percentage of people who are extremely sodium sensitive. One of my patients has perfectly controlled blood pressure majority of the year, but every now and then kind of loses her dietary restrictions and goes overboard with the sodium and shoots her blood pressure up to 180. And within 24 to 48 hours is often back to being completely controlled. So there is definitely a group of us out there that are extremely sodium sensitive. I think if you are in that group, salt restriction is definitely of high priority. If you're not in that group, it's still worthwhile to check out and see if it's impacting your life, but it's not quite as important as for the people who have that major genetic predisposition to sodium impact on their life. On the flip side of sodium is potassium. Potassium is beneficial and actually helps get rid of sodium. You're going to want to eat some potassium-rich foods like green vegetables, sweet potatoes, bananas, nuts, and fish. These are all going to help reduce your blood pressure as we reduce that sodium. One thing everybody loves to hear, dark chocolate, 80% cocoa or higher, very high in flavonoids. So these are going to help dilate out our blood vessels. And as we dilate out those blood vessels, that's one of the forms of reducing the work on the heart and lowering our blood pressure. So great. We're able to eat some more chocolate and get our blood pressure down. It sounds like a win-win to me. Finally, berries, always a great snack. Blackberries, blueberries, raspberries, very high in our polyphenols. These are also beneficial to the heart and can help us reduce our blood pressure. For a quick review, or a more thorough review, I should say, on diet's impact on our life and health, refer back to episode 3. We talk a lot about on what we could do for our diet, how to make health changes, and what are the best choices that we can make. Number 3 really kind of goes hand in hand with diet and exercise, but weight loss. So a 2016 medical study did show that weight loss will give you that a weight loss of roughly 5% in your weight could significantly lower your blood pressure. And the great thing about it is that this is kind of all going to go hand in hand with exercise and dieting potentially and eating better. And you could all have a synergistic effect. So combining all 3 could have a major impact and really help us reduce our blood pressure without having to take any medication, or reduce our likelihood of ever needing high blood pressure medication is the other way of looking at it. Number 4, the hardest one of them all, stress reduction. We just talked about this in our last talk on the impact of stress on our body and how negative it is for our overall health. And hypertension is definitely one of those negative impacts that stress is going to have on our health. As we mentioned previously, stress is going to increase our cortisol and increase our adrenaline. Both of those are going to be increased in the fight or flight mode when we're stressed out. That's going to increase our overall blood pressure, constrict our blood vessels, and increase our heart rate. All of the things that we are trying to avoid. What's even worse is, how do most of us handle stress? Well, we often handle stress by doing the opposite of what our body needs. So when our body is stressed, we want to be healthier than ever. We want to be eating antioxidant foods, decreasing inflammation, being our healthiest, being our optimal. But what do most of us do? We combat that stress with poor choices, such as eating more sugar. That sugar crave gives us a little high, gives us a little boost, helps us deal with the stress, but it's actually deleterious to our body all at the same time. And then, unfortunately, many other people choose things such as alcohol and cigarettes, which are also going to impact your blood pressure. So we're giving ourselves this double whammy of having a negative impact on our health, and then combating it with something that's making our health even worse. So the combination often leads to higher blood pressure. So for stress reduction, we'll talk about this more in future episodes, but we're going to want to try to listen to some relaxing music, maybe do some lavender, add gratitude and mindfulness to our life. Yoga could be beneficial. There is a great app called Calm. It's a breathing app, helps you with breathing and how to kind of, what I like to say is, give yourself a timeout. If you're stressed or burnt out, you kind of go and do some breathing as a timeout until you're able to get past the stressor. once again, all this stuff is very easy to preach, very hard to do. I myself am guilty of this one as well. And it's something we're constantly working on and growing towards getting better. I think one of the most important things about stress, and I mentioned this in the last talk, is that uh, the ideal solution for stress is not realistic, right? The ideal solution is to remove the stressors. But how many of us are going to be able to remove the stressors? Most of our stressors are aspects in our daily life, from our work to our spouse to traffic, things that are totally not in our control. So what we got to really work on is looking into how to deal with our response to the stress, as opposed to removing the stressor's impact on us. Or actually, sorry, we're gonna work on improving the stressor's impact on us, because we can't actually remove the stressor itself. Number 5 really goes hand in hand with stress reduction, but deserved its own category because it's been so well studied: meditation and deep breathing. Transcendental meditation has actually been studied to reduce your blood pressure, as well as having multiple other health benefits. So we talked about with the stressor, the fight or flight response last time from stress, how it increases your sympathetic nervous system, and that revs up the body and increases those things like cortisol and adrenaline. Transcendental meditation, or other forms of meditation as well, actually do the opposite. They impact the parasympathetic nervous system, which is going to reduce all those numbers, reduce our blood pressure, reduce our heart rate, and help relax the body as a whole. Number 6, kicking those bad habits. So, cut out the alcohol or down on it and quit smoking. Both of those have an impact on raising your blood pressure. And frankly, these days it's pretty darn expensive. So, we're already in rough economic times. Let's cut out the habits that are making us less healthy and invest our money into places that are making us healthier. I always try to promote the Dr. J smoking challenge, but supposedly is illegal and unethical. And that is, for every pack of cigarettes you buy, you have to put money in the cookie jar and then match that money and give it to me, whatever you're spending on cigarettes. But we know we're not allowed to do that. So we're not going to really suggest that. But I do suggest you finding somebody who you love or care about and doing a match program where whatever you spend on cigarettes, you are going to match in the cookie jar and put it towards good use, whether that is a child or relative's school or college education, or one of my favorite ones to do with spouses is kind of give each spouse a little bit of motivation, where if one person quits smoking, they get to go on whatever trip they want with that money. And the spouse who didn't quit smoking has to support that trip, and vice versa. So, some guys might want to go on a sports trip with their friends, and some girls might want to go on a spa trip, or vice versa, depending on whatever your interests are. But, the joke is you're allowing your spouse or loved one to go on something without you, and that's your motivation. And my thought on it for the kids is that if you have money for cigarettes, what better place to put your money than towards your children's future education, rather than buying a pack of cigarettes. So keep it in mind. Definitely don't pay me. Definitely not legal. So, but hopefully you come up with a better place to put your money that motivates you to quit smoking. Number 7, improving our sleep quality. We definitely want to try to get more than 6 hours of sleep, get our rest. Sleep is when the body heals itself. We want to put our phone down and turn that TV off at night. Try to add some mindfulness into our programs and relaxing before sleep. A little bonus outside of true lifestyle, but kind of a wellness technique that has been shown to benefit blood pressure without taking a medication, is there is some data on acupuncture having some benefit. So you could try that as well. Now, if your blood pressure is very high, or you just can't seem to get your blood pressure down even after doing a lot of these lifestyle changes, just got really bad genes. I have some people in that category. you might need some medication. And at the end of the day, while we try to avoid medication if possible, you know, taking medication is still better than leaving blood pressure untreated for many, many years. So we're just going to talk about four of the most common blood pressure pills, or blood pressure classes, I should say. So number one is diuretics, or your water pills. This is one of the first lines that we use. Its main one that we often use is hydrochlorothiazide, or for people who are really retaining a lot of water, we might use a medication called furosemide, or many of you might have heard of Lasix. This helps offload us of volume, and by reducing that volume, we are going to help reduce our blood pressure. These drugs do have an effect of reducing our sodium retention, and as we're doing that, we are removing the fluid. Now, very common side effect, pretty obviously, is going to be, if we're removing fluid, it has to come out some way, and you're going to pee it out. So most people complain about the side effect of frequent urination, but unfortunately, it is the only way to get the fluid out. Side effect that medically we worry about, because you might be urinating more, is your electrolytes might drop, such as potassium, or our kidneys might dehydrate, causing us a little bit of what's called kidney insufficiency. So we want to keep an eye on that with blood work. We want to replete the potassium either with a supplement if necessary, or increase the dietary sources of potassium that we discussed above. This also helps prevent some of those side effects, such as cramping in the legs, because many people will get cramping in the legs when their potassium depletes or they're urinating too much. Another side effect to keep an eye out for is a gout flare, where you get a lot of pain in your big toe. And these are the main things that you want to keep an eye on when taking a water pill. Number two is some of the best class of drugs out there is the angiotensin receptor antagonist, or ACE inhibitors. This is common drugs are lisinopril and enalapril, or really anything ending in the word pril, the letters pril. And angiotensin receptor blockers, these class of drugs is called ARBs. These are losartan, valsartan, or anything ending in the letters artan. They both act very similarly. The ACE inhibitor is going to block the formation of a hormone of the body, the ACE inhibitor is going to block a hormone that narrows the blood vessels of the body, while the ARB is going to block the action of that hormone. So they're both having a very similar downstream effect, but the ACE inhibitor is actually blocking the hormone, while the ARB is blocking the impact of the hormone. So they're just working on different parts of a pathway to have that blood pressure effect that we need. These drugs are really, really beneficial for a lot of people with chronic diseases, such as heart failure, people with a thick heart. We talked about that above, that thick heart or left ventricular hypertrophy. People with diabetes, particularly with kidney problems from diabetes or general kidney problems. These class of drugs are considered the best ones for preventing, worsening, or even improving some of those diseases above. They're going to reduce those blood vessels, and they're going to reduce our blood pressure. Probably the most common side effect that we do see, particularly with ACE inhibitors, is people are more prone to a cough. In part of the pathway, it prevents our breakdown of something called bradykinin, which does lead to people coughing more. The ARBs do have that same side effect, but not nearly as commonly. So we might switch from an ACE inhibitor to an ARB. And in the ARB category, there's a little bit more of a risk of increased potassium, but you do see that in both categories. So in both classes of drugs, I mean. So you do want to keep an eye on your blood work, an eye on your kidneys, and looking out for a cough. Third class of drugs is calcium channel blockers. Very common ones we use are Norvasc or amlodipine or nifedipine. These are pretty potent medications. They're going to relax the muscles of the blood vessels and reduce the force and the contraction of the heart and the blood vessels. One of the most common side effects of this class of drugs is feet swelling, and that's because it can reduce the contraction of the heart. So we're going to try to avoid this in people with a weak heart, okay? Because it might lead to more fluid retention as we're not pumping the heart as well. Other side effects could be heartburn or nausea. This drug is particularly good in people who have difficult to control blood pressure and is particularly effective in African Americans. Number 4, not quite as good on blood pressure, but really a beneficial heart drug are beta blockers. Common ones include metoprolol, carvedilol, atenolol. These drugs are not really potent blood pressure medications in comparison to the other medications that we discussed, but they do reduce your heart rate and the workload on your heart. So we really like to use these drugs in people who need that impact. So people who have a weak heart or heart failure, it helps to strengthen up your heart. People with coronary artery disease or blocked arteries with symptoms such as angina or chest pain, it helps slow down the heart and puts less strain on the heart, which might get rid of those symptoms of chest pain. And people with arrhythmias or uncontrolled heart rhythms where your heart's racing, it slows down those rhythms. So we really like to use these drugs for those particular patients, more for those effects and the benefits of the treatment of the underlying disease, as opposed to treating blood pressure. A very common side effect of this, though, could be fatigue. So we're slowing you down. By slowing you down, you might feel more tired, more lethargic, less energy. They can, so there's a large category of these drugs, but some of them can cross-react with people with lung disease and exacerbate things like COPD or asthma, although not commonly. And we're usually pretty good at not putting you on the ones that do if you have that underlying disease. So there's a lot of other medications that you could use for blood pressure. And as physicians, we really like to look at the patient as an overall, get a sense of what their medical conditions are, also what their needs are. You know, some drugs are 3 times a day. Your likelihood of being able to take a 3-time-a-day drug. Some medications could be used as a patch once a week. But in terms of most common ones, that's kind of the category of the 4 most common. So once again, just in refresher, we're going to try to be as healthy as possible with Dr. J's lifestyle choices on how to prevent heart disease. If you start getting mild heart disease or to prevent hypertension, if you start getting mild hypertension or the pre-hypertension category, step up your investment into your overall health and lifestyle choices, reduce your likelihood of need of hypertension meds. We discussed above, you can really drop these numbers probably somewhere in the 10 to 20 millimeters of mercury range by doing lifestyle changes. And if you have a choice between lifestyle change, being overall healthier, or taking a medication, I would choose lifestyle change any day of the week. And for if you end up needing a medication, we talked a little bit about what medications are out there, how they benefit us, who they're most beneficial for, and what the most common side effects there are for medication. So hopefully now that we know a little bit more about high blood pressure, we can learn all together about other diseases as well and other ways of wellness and lifestyle and how to prevent these diseases and treat them moving forward. So thanks, guys, and talk to you later.